We would like to welcome our guest today. He is a personal friend, Dr. Pierre Marie Wooley. Dr. Wooley is an orthopedic trauma surgeon based in Port-au-Prince, Haiti. After completing his residency in Haiti, he completed a trauma, pelvic, and acetabular surgery fellowship in the United States. He now serves as an associate professor at the University of Notre Dame School of Medicine in Haiti and the orthopedic residency academic director at HEP La Paix State University Hospital. He also serves as the major liaison for the Harvard Haitian Annual Assembly for Orthopedic Trauma, or HAOT. His passion lies in research for improving education and global surgery in his home country of Haiti and other low-income countries. So with that, we'd like to welcome Dr. Pierre Marie Wooley.
Thanks for having me, guys.
It's our pleasure. We're excited to have you and talk a little bit about both COVID as well as the Haitian earthquake back in 2010. So for our listeners who aren't very familiar with that earthquake, could you tell us a little bit more about the earthquake and what was the aftermath in Haiti like?
Yeah, so the earthquake happened in 2010, in January 12. For those who don't remember that around the world, I think that was probably because they weren't born yet or they were very young, as this was in major news all around the world. So it was a 7.2 magnitude earthquake that happened a little bit around the capital of Port-au-Prince, which is the capital of Haiti. And it was it was quoted as the largest urban disaster in modern history. We had about 250,000 people died and around 300,000 people injured. And we had like about $14 billion, I think, of loss. And over 5 million people displaced from their homes because of that disaster. So it was a pretty big disaster, and that really made the news around the world.
You mentioned a lot about the human cost and obviously the economic cost, but how did this earthquake affect the medical infrastructure and the medical system?
So everything went down around Port-au-Prince area, and so Haiti is already a low-income country. We are the poorest country in the Western Hemisphere. We were before the earthquake one of the poorest countries on earth, and so always hit by social, economical, political unrest all the time. And so that natural disaster just tear down everything, including the infrastructures for healthcare. So we were really faced with even dire problems because of what we didn't have before, in just that the structures, the hospitals, the buildings kind of collapsed, most of them. So it was a really big deal at that time. And it was a really traumatic incident that none of us will ever forget, for sure.
Can you tell us a little bit more about the medical system, like the personnel and the workflow? What happened during that time? Obviously, it's kind of like COVID, where we are just suddenly, the healthcare system was bombarded with, like, overcome with so many people all at one time. So can you tell us a little bit about what it was like being in that situation?
There's a lot of similarities between the COVID pandemic and the earthquake. I think the difference between COVID pandemic and the earthquake was mostly, earthquake was traumatic. It was a one-time, one-moment thing, and it just it just generated a lot of problems in one time, whereas COVID is pretty much still going on and still creating problems. But in terms of saturation of the hospital, it was pretty much the same thing. A lot of people got injured in one time, and the healthcare infrastructure wasn't ready to receive those people. And what happened at that moment was that people just went to the hospitals, multiple millions of people going, in hospitals that were already collapsed themselves. And so the workers, the health professionals, everybody was, trying to tend to their families, trying to understand what was going on. So it was really a chaotic time. And the saturation of the hospital, the people going into the hospitals, pretty much like COVID, they didn't have enough beds. Those hospitals that were still standing. And it was just a really big chaotic magna of problems. And I guess the only difference is, over time, hospitals got saturated from the capital going up to the provinces, whereas COVID, everybody is still getting saturated because nobody knows what to do. So it was a really bad bad time for the country. And it was but it really showed us, how a disaster of a great scale can just collapse everything in just a few seconds.
Mm. And I know these are obviously disasters or natural disasters in two very different forms. What lessons did you learn from the earthquake that you found to be relevant to dealing with COVID today?
I think that what is relevant is what you learn from those traumatic experiences. The earthquake was, like I mentioned, the largest urban disaster in modern history in terms of trauma. And what we learned from that was, first of all, we weren't prepared. Can somebody be prepared for such an event? I don't know. I have the answer for that. And the other thing is, what can you do to prevent it? I don't think there's also an answer to that, because it is an earthquake. You can't, scale, what you can respond. So I think what we mostly learned out of the earthquake was how to respond to such a disaster in a way that's going to save the maximum people and the maximum lives. And COVID, I think, is the same thing, because it just hit the world in one time, and not knowing. I guess the difference is not knowing what it was initially. So people were like, we should do this, we should do that, and we don't know what to do. Whereas the earthquake, it was trauma. We just didn't have the resources to do what we needed to do, or the infrastructure to help us in that sense. But it's also the same mass casualty, mass people going to hospital, and just, you're dealing with a disaster that, is unprecedented. Both of them in their own form, and you don't really know what to do, and you're kind of going along with it as times progress. And you do make a lot of mistakes initially, for sure, both.
Sure. I mean, we are going to make mistakes when you haven't seen anything, and that's why we do lots of training for disasters and different things in our medical training, right? Is to be able to prepare for some of these things. But as you said, no one is prepared for the largest earthquake or for a global pandemic that was completely unexpected. So,
I think what you just said is, I think the last part of what I was going to emphasize on is that you learn from what happened. And actually, the disaster management protocols in the US, for example, a lot of them were lessons learned from the ground in Haiti. So what they changed their protocols, their drills, how to manage mass casualty disasters, and really learn from those experiences. So there is also some positive out of those major pandemics or those major disasters.
yeah, definitely good lessons learned. Kind of shifting a little bit more towards COVID, how has COVID really been affecting surgery in Haiti for you? And what adaptations have you guys had to change because of that setting?
Well, we have to be honest and say that we've been fortunate enough to have respected a lot of the principles early on. The government closed the borders very early on in this pandemic, early March, and when the U.S. was actually trying to understand what was going to happen. And so by and wearing masks and social physical distance, I call it physical distance, not social distance. But it's, we've been lucky enough to have less than 250 deaths so far over 6 months. And we are not as affected as some of the other places. We did have the month of June where we had a bunch of cases, but our hospitals were never saturated to a point of no return, especially in a country like mine where it's a low-income country. You don't have the resources, you don't have the manpower or the ventilators or anything like that. So I think that we were I guess blessed enough or fortunate enough to not go to that point. But we did respect a lot of the principles learned from other countries, mostly the ones in Europe. We did take their advice early on, and I think that's one of the key things that kind of saved a lot of what could have happened so far.
And I think what you're saying makes complete sense, that prevention, especially when you know that your healthcare infrastructure or any healthcare infrastructure would struggle to deal with the volume of cases that some countries are seeing. Thank you so much for speaking to us about your experience with both the earthquake and also how it's been relevant to this current pandemic. It's been really useful to hear about this experience.
Thank you very much. I really appreciate being here, and thank you for the invitation to share our perspective on this thing that it's affecting all of us. So for sure, thank you.
Thank you so much. I think it's really important. And for those of you listening at the conference, if you'd like to hear the rest of this episode, you can go to globalscalpels.com and listen there, or you can watch on your favorite podcast platform, whether it's Apple Podcasts or Spotify. So we thank you for joining us.